What is the primary difference between public and private healthcare systems, and how do the roles of primary, secondary, and tertiary healthcare services differ within each system? Answer: the primary difference between public and private healthcare systems lies in their funding and governance. Public healthcare systems are funded primarily by government taxes and are designed to provide universal healthcare coverage to all citizens, often at little or no cost to the individual. Examples include the National Health Service (NHS) in the UK or Medicare in Canada. On the other hand, private healthcare systems are funded through private payments or insurance and are usually characterized by market-driven approaches where individuals or employers bear a larger share of healthcare costs. Primary care refers to the first point of contact in healthcare, typically provided by general practitioners or family doctors. In both public and private systems, primary care focuses on preventive services, routine checkups, and managing common illnesses. Secondary care involves more specialized services, often provided by specialists or hospitals. Patients typically need a referral from primary care providers to access secondary care. Tertiary care provides highly specialized care, typically in advanced hospital settings. This level of care is focused on specialized treatments like surgery, cancer care, or complex diagnostic procedures. How does socioeconomic status influence an individual's access to healthcare, and what public health policies can mitigate these disparities? Answer: socioeconomic status plays a significant role in determining an individual's access to healthcare. People with lower SES often face barriers such as limited financial resources, inadequate health insurance, and poor living conditions, which contribute to higher rates of chronic diseases, poorer mental health, and reduced access to necessary healthcare services. SES can also impact education, employment, and living conditions, all of which influence health outcomes. Public health policies aimed at mitigating these disparities include universal healthcare coverage, ensuring that everyone, regardless of income, has access to basic healthcare services; subsidized healthcare programs, providing government assistance for low-income individuals and families to afford health insurance, e.g., Medicaid in the US; community health initiatives, offering services such as free health screenings, vaccinations, and educational programs in underserved areas; improving housing and nutrition. Programs that address basic needs such as affordable housing and access to healthy food can have long-term positive effects on public health. What are the most effective community-based interventions to reduce alcohol consumption, and how can these strategies be evaluated for effectiveness? Answer: community-based interventions to reduce alcohol consumption typically focus on prevention, education, and support services. Effective strategies include public education campaigns. These campaigns raise awareness about the risks of excessive alcohol consumption and provide information on the benefits of moderation. Social norms campaigns. Changing the social acceptability of drinking behaviors, particularly in certain social settings, can help reduce alcohol use. Support groups and treatment programs. Programs like Alcoholics Anonymous or community-based counseling services can provide the social support and therapy needed for individuals struggling with alcohol addiction. Policy measures. Enforcing stricter regulations on alcohol sales, e.g., age restrictions, limits on alcohol availability, can also curb consumption. To evaluate these strategies, public health professionals often use surveys to track alcohol use in the population before and after interventions. Focus groups and community feedback are valuable tools for assessing the impact on individuals' attitudes and behaviors. Mr. Rodriguez, a policymaker in a local government, is tasked with creating a new health policy to increase access to mental health services in underserved areas. His team has gathered data that show a significant gap in the availability of services in rural regions. Given the budgetary constraints and the need for immediate results, what steps should Mr. Rodriguez take to develop a policy that will address these disparities? Answer: Mr. Rodriguez should follow a strategic process that balances the need for immediate impact with the reality of budget constraints. Key steps would include data analysis. Mr. Rodriguez should thoroughly analyze the collected data to identify the most significant barriers to accessing mental health services in rural areas. Stakeholder engagement. Engage with local healthcare providers, mental health professionals, and community leaders to gather insights and support for the policy. It is also essential to involve the community to ensure the policy meets their needs. Cost-effective strategies. Considering budget constraints, Mr. Rodriguez could explore low-cost interventions such as expanding telemedicine services for mental health care, which would allow individuals in rural areas to access care without the need to travel long distances. Partnerships. Collaborating with non-profit organizations and federal or state mental health agencies could help secure additional resources or funding for the initiative. Implementation and monitoring. Mr. Rodriguez should ensure that the policy is implemented in phases, with ongoing evaluation to assess its effectiveness. Data-driven adjustments should be made to address any emerging issues. What are the economic implications of a shift from fee-for-service (FFS) to value-based care in healthcare systems, and how does this change affect the quality of care? Answer: a shift from fee-for-service (FFS) to value-based care (VBC) involves a significant change in the way healthcare providers are compensated. Under FFS, providers are paid based on the volume of services they deliver, which can incentivize overutilization of services and higher healthcare costs. In contrast, value-based care rewards healthcare providers for delivering quality care rather than quantity, emphasizing outcomes and patient satisfaction. Economic implications. Cost control. VBC can reduce overall healthcare spending by focusing on preventive care and managing chronic diseases rather than paying for each service provided. Resource allocation. Providers may shift resources toward high-quality, cost-effective treatments and preventive measures, which can lead to better long-term health outcomes. Incentives. Providers are incentivized to work more efficiently, reducing unnecessary tests, procedures, and hospital readmissions. However, this requires accurate data collection and monitoring systems to track performance. Impact on quality of care. Patient outcomes. VBC aims to improve patient outcomes by focusing on long-term health management, which can result in fewer hospital admissions and better overall health. Provider collaboration. VBC often promotes coordination between primary, secondary, and tertiary care providers, improving the continuity of care. Patient-centered care. By incentivizing healthcare providers to focus on the overall health and satisfaction of patients, VBC encourages more personalized and comprehensive care plans. What psychological factors contribute to poor health behaviors, such as smoking or poor diet, and what interventions can public health professionals implement to modify these behaviors? Answer: psychological factors such as stress, depression, low self-esteem, and social influences often contribute to poor health behaviors like smoking, poor diet, and lack of physical activity. These factors can create a cycle where individuals use unhealthy behaviors as coping mechanisms. Stress. High stress levels can lead to smoking or overeating as individuals attempt to self-medicate. Chronic stress is also linked to a higher risk of heart disease and other health issues. Depression and anxiety. Mental health conditions often lead to unhealthy coping strategies such as substance use or unhealthy eating, which exacerbate physical health problems. Social and environmental factors. Peer pressure, cultural norms, and living conditions can all influence an individual's behavior. For instance, individuals in lower socioeconomic conditions may have limited access to healthy foods and exercise opportunities. Public health interventions to modify these behaviors include behavioral counseling. Cognitive behavioral therapy (CBT) can help individuals change negative thought patterns and adopt healthier behaviors. Stress reduction programs. Interventions such as mindfulness training or yoga can help individuals manage stress in healthier ways. Community interventions. Creating supportive environments where healthy behaviors are promoted, e.g., smoke-free zones, access to nutritious foods, can encourage individuals to adopt healthier lifestyles. What are the key differences between clinical outcomes and patient satisfaction as measures of healthcare quality, and how can these two metrics be used together to improve healthcare services? Answer: clinical outcomes refer to the measurable results of healthcare interventions, such as recovery rates, survival rates, and the reduction of disease symptoms. These outcomes are objective and based on clinical data, providing insights into the effectiveness of medical treatments. Patient satisfaction measures a patient's subjective experience of care, including their perceptions of communication, respect, and the quality of the healthcare environment. Patient satisfaction surveys often address aspects like waiting times, staff friendliness, and the thoroughness of the explanation given by healthcare providers. While clinical outcomes are essential in determining the effectiveness of medical treatments, patient satisfaction provides valuable feedback on the care process. The integration of both metrics allows for a more holistic view of healthcare quality. For example, while a patient might recover from an illness, clinical outcome, their experience during the treatment process can affect their willingness to adhere to future treatments. Combining these metrics can help healthcare organizations identify areas for improvement both in clinical practice and patient-centered care. How do health disparities between racial and ethnic groups manifest in public health, and what strategies can be implemented to address these disparities? Answer: health disparities between racial and ethnic groups are widespread, with certain populations experiencing poorer health outcomes due to a variety of factors, including socioeconomic status, access to healthcare, cultural barriers, and historical discrimination. For example, African Americans and Hispanics in the U.S. often experience higher rates of chronic diseases like diabetes and hypertension compared to white populations. Key strategies to address these disparities include cultural competence training, ensuring that healthcare providers understand the unique cultural needs and beliefs of diverse populations; community outreach, providing targeted health education and services to underrepresented groups to improve health literacy and access to care; policy reform, advocating for health policies that specifically target social determinants of health, such as affordable housing and access to quality education; equitable healthcare access, expanding healthcare services in underserved areas through mobile clinics, telemedicine, and insurance coverage. What role do advocacy groups play in influencing healthcare policy, and how can public health professionals effectively collaborate with these organizations to advance health reforms? Answer: advocacy groups are organizations that work to influence public policy in favor of specific health issues or populations. They play a critical role in raising awareness, mobilizing public opinion, and advocating for legislative changes to address public health challenges. These groups often have expertise in specific areas such as mental health, tobacco control, or healthcare access, and can use a variety of methods, including lobbying, public campaigns, and coalition building to push for reforms. Public health professionals can collaborate with advocacy groups in the following ways: partnerships, working together to craft evidence-based policies that can be presented to lawmakers; research, collaborating on studies that provide data to support policy changes; public engagement, assisting in organizing campaigns that educate the public on health issues and mobilize them to demand change. By leveraging the influence of advocacy groups, public health professionals can strengthen the case for policy reforms and ensure that healthcare policies are more equitable and evidence-based. Why is cultural competence essential for public health professionals, and how can cultural humility be integrated into health interventions? Answer: cultural competence is crucial for public health professionals because it allows them to effectively serve diverse populations with varying beliefs, practices, and health needs. It involves understanding and respecting cultural differences in healthcare behaviors, communication styles, and treatment preferences. Public health interventions that are culturally appropriate are more likely to be successful because they are tailored to meet the specific needs of the population. Cultural humility is an ongoing process of self-reflection and learning where public health professionals recognize their own biases and engage with communities in a respectful and open-minded manner. To integrate cultural humility into health interventions, public health professionals can engage community leaders, collaborate with community representatives to ensure that health interventions are culturally relevant and appropriate, provide training, offer ongoing cultural competence training to healthcare providers to enhance their understanding of diverse cultures, adapt interventions, customize health programs to fit the cultural norms and values of the target population, ensuring better acceptance and adherence. Discuss the importance of primary prevention strategies in the control of chronic diseases such as heart disease and diabetes. How do lifestyle changes compare to other primary prevention strategies in terms of long-term effectiveness and cost-effectiveness? Answer: primary prevention is essential in reducing the incidence of chronic diseases by preventing risk factors before they develop into diseases. Strategies for primary prevention include promoting healthy behaviors such as a balanced diet, physical activity, smoking cessation, and alcohol moderation. These interventions are often more cost-effective compared to secondary and tertiary prevention methods, as they prevent diseases from occurring in the first place, reducing the need for costly treatments. Lifestyle changes, such as improved diet and regular physical activity, have been shown to have significant long-term effectiveness in preventing diseases like heart disease, stroke, and type 2 diabetes. For instance, regular physical activity can reduce the risk of heart disease by up to 30%, and dietary changes can lower the risk of diabetes. These lifestyle changes are not only beneficial for individuals, but also reduce the financial burden on the healthcare system by preventing the need for more expensive medical treatments in the future. From a cost-effectiveness perspective, primary prevention strategies generally offer the greatest return on investment. For example, the CDC's diabetes prevention program found that lifestyle interventions were more cost-effective than pharmaceutical interventions for preventing diabetes. What are the critical components of prenatal care that contribute to maternal and child health outcomes, and why are they important for reducing risks such as preeclampsia and gestational diabetes? Answer: prenatal care is essential for ensuring the health of both mother and child during pregnancy. The key components of prenatal care include routine screenings and tests. These are used to identify potential risks such as gestational diabetes, preeclampsia, and birth defects. Early detection through blood pressure monitoring and urine tests is critical for preventing complications. Nutritional guidance. A balanced diet is recommended to support fetal growth and prevent conditions like gestational diabetes and low birth weight. Proper intake of folic acid is essential to prevent neural tube defects. Education and counseling. Prenatal care includes counseling on lifestyle modifications, including diet, exercise, and avoidance of harmful substances like tobacco and alcohol. Mental health support. Screening for mental health issues such as anxiety and depression is important, as maternal mental health directly affects both pregnancy outcomes and child health. Vaccinations and preventive measures. Ensuring the mother receives necessary vaccinations, e.g., flu and Tdap, helps protect both her and the baby from infections that could complicate pregnancy. These elements are critical in preventing complications such as preeclampsia and gestational diabetes. Preeclampsia, characterized by high blood pressure, can lead to premature birth or fetal growth restriction if left unmanaged. Gestational diabetes increases the risk of type 2 diabetes for both the mother and child. Effective prenatal care reduces the risks of these conditions by identifying and managing them early. Sarah, a 29-year-old woman, is pregnant with her first child at 24 weeks gestation. During her routine prenatal visit, her blood pressure readings are consistently high and her urine tests indicate protein. What steps should Sarah's healthcare provider take to manage her condition, and what are the potential risks if her condition progresses to preeclampsia? Answer: Sarah's symptoms, including high blood pressure and proteinuria, suggest the possibility of developing preeclampsia, a condition that typically occurs after 20 weeks of gestation. The provider should immediately take the following steps. Confirm diagnosis. The healthcare provider should confirm the diagnosis by conducting additional tests such as blood tests for liver and kidney function, monitoring Sarah's blood pressure regularly, and assessing her overall health. Monitor fetal well-being. The provider should schedule ultrasounds and non-stress tests to monitor the baby's growth and heart rate, as preeclampsia can affect fetal development. Medication management. If preeclampsia is diagnosed, medications such as antihypertensives may be prescribed to control blood pressure and prevent further complications. Discuss delivery options. If Sarah's condition worsens or if her blood pressure remains high despite medication, early delivery may be necessary. This could involve induction or a cesarean section depending on the severity of the preeclampsia. Referral to specialists. If the condition becomes severe, a referral to a maternal fetal medicine specialist may be needed. If preeclampsia progresses, it can lead to serious complications for both mother and child, including eclampsia, seizures, placental abruption, organ damage, and fetal growth restriction. Early intervention and careful monitoring are critical to improving outcomes. What is the role of behavioral interventions in reducing the risk factors associated with chronic diseases, and how do public health campaigns support these interventions? Answer: behavioral interventions play a central role in reducing the risk factors for chronic diseases such as smoking, poor diet, physical inactivity, and excessive alcohol consumption. These interventions aim to modify individual behaviors and improve lifestyle choices to prevent disease onset. Examples of behavioral interventions include smoking cessation programs. These programs use counseling, medications, and support groups to help individuals quit smoking, thereby reducing the risk of lung cancer, heart disease, and respiratory conditions. Physical activity promotion. Public health initiatives encourage individuals to engage in regular exercise, which can reduce the risk of obesity, diabetes, and cardiovascular disease. Nutrition education. Programs aimed at promoting healthy eating habits help individuals manage weight, reduce the risk of diabetes, and lower cholesterol levels. Stress management. Behavioral strategies such as mindfulness and relaxation techniques can help reduce the impact of stress on cardiovascular health. Public health campaigns support these interventions by raising awareness, providing resources, and encouraging policy changes that promote healthier environments. For example, tobacco control campaigns, such as smoking bans in public places and graphic warning labels on cigarette packages, reduce smoking rates in related chronic diseases. Explain the significance of immunization in reducing childhood morbidity and mortality. How does it contribute to public health goals such as herd immunity? Answer: immunization is one of the most effective public health strategies for reducing childhood morbidity and mortality. Vaccines prevent the spread of infectious diseases such as measles, polio, and diphtheria, which can have severe consequences for children. Immunization provides both individual protection and contributes to broader public health goals, including herd immunity. Individual protection. Vaccines protect individual children from serious diseases, reducing the risk of complications such as hospitalization, long-term disability, and death. Herd immunity. When a high percentage of the population is immunized, it reduces the overall transmission of infectious diseases, even among those who are not vaccinated. This is particularly important for vulnerable populations, such as infants, pregnant women, and immunocompromised individuals who may be at higher risk of contracting diseases. Herd immunity helps prevent outbreaks, decreases the burden on healthcare systems, and is critical in eliminating diseases. For example, the widespread vaccination against polio has brought the world closer to eradicating the disease. Discuss the factors influencing adolescent health and how public health programs can address these challenges. Answer: adolescence is a critical period of development marked by significant physical, emotional, and social changes. Several factors influence adolescent health, including mental health issues. Adolescents are vulnerable to mental health conditions such as depression, anxiety, and eating disorders, which can impact their overall well-being. Substance use. The use of tobacco, alcohol, and illicit drugs is common during adolescence and can lead to long-term health issues, including addiction and chronic diseases. Sexual health. Adolescent sexual health is a critical area, with issues such as teenage pregnancy, sexually transmitted infections, STIs, and access to reproductive health services. Obesity and physical activity. Poor diet and lack of exercise contribute to adolescent obesity, which increases the risk of developing chronic diseases later in life. Public health programs can address these challenges by implementing mental health support programs. Schools and communities can offer counseling services to help adolescents cope with stress and mental health issues. Promoting healthy lifestyles. Public health campaigns can encourage physical activity, healthy eating, and discourage substance abuse. Providing sexual and reproductive health education. Comprehensive sex education, including access to contraceptives and STI prevention, helps reduce teenage pregnancies and the spread of infections. Advocating for policy changes. Policies that limit access to tobacco and alcohol, as well as those promoting safe school environments, can reduce adolescent risk factors. How does coordinated care in chronic disease management enhance patient outcomes, and what are the key components of an integrated care model? Answer: coordinated care is essential in managing chronic diseases such as diabetes, hypertension, and heart disease. It involves collaboration between healthcare providers, patients, and caregivers to ensure that the patient's care is comprehensive and continuous. This approach helps improve outcomes by reducing fragmented care. Coordinated care prevents patients from receiving conflicting or duplicate treatments, which can lead to confusion and poorer health outcomes. Improving patient adherence. Patients are more likely to follow treatment plans when they receive consistent support from a team of healthcare providers who communicate effectively. Enhancing preventive care. Coordinated care ensures that patients receive timely screenings, vaccinations, and lifestyle counseling to prevent further complications. An integrated care model typically includes multidisciplinary teams. Healthcare providers from various specialties, e.g., physicians, nurses, dietitians, social workers, work together to manage the patient's care. Patient-centered approach. The patient's preferences and needs are central to the care plan, and they are actively involved in decision-making. What is the impact of socioeconomic factors on maternal health, and how can public health interventions address these disparities? Answer: socioeconomic factors significantly affect maternal health outcomes. Women from lower socioeconomic backgrounds often experience high rates of maternal morbidity and mortality due to limited access to quality healthcare, poor nutrition, and higher levels of stress. Key factors include access to healthcare. Women in lower-income communities may not have access to regular prenatal care or specialized services, leading to undiagnosed complications. Living conditions. Poor living conditions, including inadequate housing and environmental stressors, can contribute to pregnancy complications. Education. Women with lower educational attainment may lack knowledge about prenatal care, nutrition, and warning signs of complications. Public health interventions can address these disparities by improving access to healthcare. Expanding healthcare coverage, especially for low-income populations, ensures that all women can access prenatal care. Community health programs. Targeted interventions, such as home visits from nurses or community health workers, can provide education and support in underserved areas. How do public health systems evaluate the cost-effectiveness of chronic disease management programs, and why is this evaluation important for resource allocation? Answer: Public health systems evaluate the cost-effectiveness of chronic disease management programs by comparing the costs of the program with the health outcomes it achieves. This includes analyzing factors such as costs, direct costs, e.g., medical expenses, medications, healthcare services, and indirect costs, e.g., productivity losses, are considered. Health outcomes. These may include reductions in disease prevalence, improvements in quality of life, and the reduction of hospitalizations. Cost-effectiveness is evaluated through metrics like quality-adjusted life years, QALYs, or disability-adjusted life years, DALYs, which quantify the health benefits of a program relative to its costs. Evaluating cost-effectiveness is critical for resource allocation because it helps policymakers determine which programs provide the best return on investment. In resource-limited settings, prioritizing cost-effective programs ensures that limited funds are used in ways that maximize health benefits for the population. How can addressing the social determinants of health improve maternal and child health outcomes, particularly in marginalized communities? Answer: Social determinants of health, such as income, education, employment, and social support, play a significant role in shaping maternal and child health outcomes. Addressing these factors can significantly improve health outcomes by increasing access to care, addressing income inequality, and improving healthcare access through insurance coverage or subsidized care ensures that all women, regardless of their socioeconomic status, receive timely prenatal and postnatal care. Promoting education. Educating women and families about healthy behaviors, family planning, and prenatal care can lead to better health choices and outcomes. Improving housing and environment, ensuring safe and stable housing, as well as access to clean water and sanitation, reduces the risk of maternal and child health complications. Public health initiatives that target social determinants can lead to healthier communities by promoting equity, reducing disparities, and ensuring that all individuals have the resources they need to lead healthy lives. What is the distinction between personal health and public health, and why is this distinction important in the design of health policies? Answer: Personal health focuses on the well-being of an individual, addressing personal lifestyle choices, medical treatment, and preventive care on an individual level. Public health, however, involves the health of entire populations, focusing on prevention, health education, policy advocacy, and population-wide interventions to prevent disease and promote wellness. The distinction is crucial in policy design because public health policies aim to address systemic issues that affect large groups, such as sanitation, environmental hazards, and healthcare access, whereas personal health policies typically cater to individual behaviors and choices. Public health policies often prioritize collective good over individual autonomy to safeguard the health of the community. For example, laws requiring vaccinations are a public health measure that balances individual autonomy with the need to protect public health from outbreaks of infectious diseases. These policies are grounded in the principle of utilitarianism, which focuses on maximizing well-being for the greatest number of people. In the context of public health, how do autonomy and justice interact when implementing health interventions such as quarantine measures? Answer: Autonomy refers to the individual's right to make their own decisions about their health, while justice in public health refers to fairness in the distribution of health resources and burdens. In the case of quarantine measures, public health authorities may restrict an individual's autonomy to protect the larger population. The challenge arises in balancing these ethical principles. On one hand, enforcing quarantine limits individual freedoms, autonomy, but on the other, it serves the public's interest in preventing the spread of disease, thereby promoting social justice by protecting vulnerable populations and ensuring equal protection for all. The principle of proportionality ensures that such restrictions are justified, necessary, and the least restrictive means available. For example, the legal framework that supports quarantine measures, such as those under the Public Health Service Act, often permits restrictions only when they are scientifically supported and serve a clear public health objective, ensuring fairness and equity in their enforcement. MS. Peterson works as a public health officer in a community affected by an outbreak of a contagious disease. The local government has decided to implement a vaccination mandate to contain the disease. Some individuals in the community object to the mandate, citing concerns about personal autonomy and vaccine safety. How should MS. Peterson approach this situation? Answer: MS. Peterson should first ensure that the vaccination mandate is backed by strong scientific evidence demonstrating that the vaccine is safe and effective in preventing the spread of the disease. She should provide transparent information to the community about the risks of the disease and the benefits of vaccination, addressing any misinformation. MS. Peterson must also consider the ethical principles involved. While respecting individual autonomy is important, the principle of beneficence, acting in the best interest of the public, and just as fairly distributing health protections may override personal objections in the face of a public health crisis. Additionally, legal authorities such as the Public Health Service Act and CDC guidelines provide the legal framework for mandatory vaccination programs in emergencies. She could facilitate public dialogue, involve community leaders to advocate for the mandate, and offer exemptions only in medically justified cases, ensuring the policy is as equitable and respectful as possible. What are the key differences between a centralized and a decentralized public health system, and how do these differences impact health policy effectiveness? Answer: a centralized public health system is one where decision-making, funding, and policy implementation are controlled by a central government or authority, often at the national level. A decentralized system, on the other hand, gives more autonomy to local or regional governments to make decisions and implement policies tailored to the specific needs of their populations. The main difference lies in control and flexibility. A centralized system allows for uniformity and consistency in policy implementation, which is especially beneficial in large-scale health crises such as pandemics. However, it can be slow to respond to local needs and may not account for regional disparities. In contrast, a decentralized system allows for more responsive and context-specific interventions, but it can lead to inconsistency in health outcomes across regions. Public health experts, such as those in the World Health Organization, who emphasize the need for decentralized systems to have strong communication and coordination mechanisms to avoid inefficiencies or inequities in health service delivery. Why is it essential to address social determinants of health in efforts to achieve health equity, and how can public health policy address these determinants? Answer: social determinants of health, SDH, such as income, education, employment, and environmental conditions, play a significant role in determining health outcomes. Addressing these factors is essential for health equity because they contribute to disparities in access to care and health outcomes, often exacerbating conditions for marginalized populations. Public health policy can address SDH through strategies like improving access to education, housing, and healthcare, as well as implementing policies that reduce income inequality and environmental hazards. For instance, the Affordable Care Act in the U.S. aims to reduce health disparities by expanding Medicaid and improving access to preventive care. Additionally, programs targeting early childhood development, nutrition, and safe housing can mitigate the effects of adverse SDH. Addressing these social factors is not only a moral imperative, but also an effective strategy for reducing long-term healthcare costs by preventing chronic diseases and promoting overall population health. What role do legal frameworks play in controlling communicable diseases, and how do laws such as quarantine and mandatory reporting of diseases support public health objectives? Answer: legal frameworks are critical in enabling public health authorities to protect the community from communicable diseases. Laws that mandate quarantine and isolation, for example, allow authorities to restrict the movement of individuals who may have been exposed to or infected by contagious diseases. These legal measures are grounded in the principle of public health security, ensuring that the health of the population is protected from widespread outbreaks. Mandatory disease reporting laws, such as those under the National Notifiable Diseases Surveillance System and NSS in the US, require healthcare providers to report certain infectious diseases to local, state, and national health agencies. This helps track outbreaks, allocate resources, and implement interventions in a timely manner. Both quarantine and disease reporting are vital tools in disease control as they enable rapid response and prevent further spread. However, they must be applied judiciously to ensure they are proportionate to the public health threat and do not infringe unnecessarily on individual freedoms. What is the role of the World Health Organization, WHO, in global public health, and how does it coordinate international responses to health crises? Answer: the World Health Organization, WHO, plays a central role in global public health by providing leadership on international health matters, setting standards and policies, and coordinating responses to health crises. The WHO is responsible for monitoring global health trends, conducting research, and providing technical assistance to countries in areas such as disease prevention, health systems strengthening, and health promotion. In the event of a global health crisis, such as the COVID-19 pandemic, WHO coordinates international efforts by providing guidance on health interventions such as quarantine procedures, testing protocols, and vaccination strategies. The WHO also works to ensure equitable access to health resources, such as vaccines, especially in low-income countries through initiatives like EOVAX. Additionally, the WHO plays a critical role in fostering international cooperation and communication, especially in the context of pandemics where cross-border collaboration is essential for controlling the spread of disease. Explain the ethical dilemmas associated with public health surveillance and how should public health agencies address concerns related to privacy and data security. Answer: public health surveillance involves the systematic collection, analysis, and dissemination of health-related data to monitor the health of populations and identify trends. While this information is critical for effective public health interventions, it raises ethical concerns, particularly regarding privacy and data security. The ethical principle of autonomy is challenged when personal health data is collected and shared without explicit consent. Additionally, surveillance programs may disproportionately affect vulnerable populations, raising concerns about justice and non-maleficence. Do no harm. Public health agencies must ensure that surveillance is conducted transparently with clear communication about its purpose and scope. Measures should be taken to protect data confidentiality and minimize the risk of misuse. Laws such as the Health Insurance Portability and Accountability Act (HIPAA) in the U.S. provide frameworks for safeguarding health information, while public health agencies must engage in regular ethical reviews to balance the benefits of surveillance with the rights of individuals. Dr. Thomas, a public health researcher, has been asked to conduct a study on the health effects of a new drug. Some of the study participants are minors, and Dr. Thomas is concerned about the ethical implications of obtaining consent from them and their guardians. What steps should Dr. Thomas take to ensure the study is conducted ethically? Answer: Dr. Thomas must adhere to ethical principles such as autonomy and beneficence while conducting the study. For minors, consent must be obtained from both the minor's legal guardian and, if appropriate, from the minors themselves assent. The principle of non-maleficence requires Dr. Thomas to ensure that the drug does not pose undue risk to participants, particularly minors, who may be more vulnerable to side effects. Dr. Thomas should also ensure that the study follows ethical guidelines, such as those outlined in the Declaration of Helsinki, which emphasizes the protection of human subjects in research. Additionally, Dr. Thomas should submit the study to an institutional review board to ensure that it meets ethical and safety standards. What are the implications of health disparities in public health practice, and how should public health practitioners address them to improve population health outcomes? Answer: health disparities refer to the differences in health outcomes that are closely linked with social, economic, and environmental disadvantages. These disparities often affect marginalized groups, including racial minorities, low-income populations, and rural communities, leading to poorer health outcomes. Public health practitioners must recognize that these disparities are often rooted in structural determinants, such as access to quality healthcare, education, and employment. Addressing health disparities requires multifaceted approaches, including improving access to healthcare services, reducing poverty, promoting health equity, and advocating for policies that tackle the social determinants of health. Public health interventions should be culturally competent and tailored to the needs of vulnerable groups, ensuring that health programs reach those who need them most. Practitioners should also engage in advocacy and public policy efforts to reduce inequities in the distribution of health resources.